cervical lesions. And what are they? Well, here we see abfractions and abrasions accompanied by erosion. Abfraction is included in the non-carious lesions, and it is the loss of or breakage of the thin layer of enamel and abrasion of the tissue in the part closer to the gums caused by the strength applied on the tooth. Now, abrasions are generated especially in the neck area due to a wrong brushing with excessive strength. And I would like to say again that these lesions are always accompanied by erosions, and these lesions start in an erosive way, and then we also see abfractions and abrasions. Now, in this part of the presentation, we would like to talk about material selection. The material that will be applied in the neck is very important because it affects directly on the adhesion, resistance, retraction, and long-term stability. So we need to really select well the materials and also the way they will be applied. We need to know very well the materials that we will select. Many researches have been done on this, and there are many studies which compare the different materials. And after a close evaluation, I must say that composite materials applied in the cervical area are very successful from a clinical point of view, especially for non-carious lesions, where, of course, the resistance is a great problem. We, of course, need to ensure that the isolation is well done. This is really very important. Well, the new generation material, like flowables, have become a competitive alternative to the conventional ones, both from the point of view of its convenience in use and the success of the results. So you can also use this type of new materials. So, selection of the shade. This is the very first thing to do. This is the really first step right away. We cannot waste time with the greetings and then say to the patient, let's wait a minute. No, first we have to do that. Of course, there are many methods. For example, you can take pictures and use various electronic devices, but we prefer to compare the shade, placing the composite in the area. If this is not enough, then we take pictures with the cross polarization, or we can also, if you look through the filter of cross polarizations, then we can decide in a better way for an accurate result. There are various studies that have been carried out that compare various methods to obtain an accurate result. And in the end, it was concluded that the best technique is cross polarization. Here you see one of the images taken by Bora. The area here, well, here it's best to place it on the neck of the central healthy tooth. It is better to see the color, the shade of the natural tooth, and he used two bodies. Here we see the conventional composite omnichroma, because omnichroma is also the new generation composite, that is to say, flowable. So I place this composite on the area and I polarize it. You see that after polarization, the color has perfectly adapted. This is a picture taken with the cross polarization. You see here, you can see that this composite that does not contain the color pigment adapts better to the natural tissues of the tooth. Now, in this picture, we see that filters are really useful for us because then there are no flashes and we can see better the internal structure of the tooth. Now, florables. Uh, this new generation composite, Omnichroma. As you know, there are two types of products. One is blocker, with which we can camouflage the underlying part, and the other one is a normal fluid composite. The filling percentage is very stable. It can also be used in the posterior part. Here we're talking about a filling percentage in terms of weight of about 60-65%. This is the condition before polymerization, and this was obtained through cross-polarization, and you see then the condition after polymerization. Here I would like to talk also about retraction cords. This is a very important product for us, especially to retract the gums, not only to maintain maintain healthy gums, but also to see better our application area. Here we see one of the interesting cases, important cases by Bora. This is an abrasion, and the picture has been taken closely. Well, the retraction cord was applied very, very well by him. Bora, did you do it in a continuous way or one by one? Well, one by one. Okay. Sometimes I do all together, so I place the cord into teeth. So this can be done, and you can finish it in only one time. So you can choose the method you like. Now this is a video with magnification. This is one of my microscopic works. This is an excessive magnification, and so it is difficult to work with such a high magnification, and I would say that 10 times in magnification is the best way. I use this here just to show you. This I think is 16 or 24 times, so it is a bit blurred. So when I place the cord, I need to push it towards the starting point of the cord. If you try and push it, then it might fray from the insertion point. You need to be very cautious, and then you use a special spatula. Now, isolation. As we said before, it's the most important thing in the reconstruction and the restoration of the gums. Do we always need to use a rubber dam? No, not necessarily. As Engin said, using the retraction cord, you can restore, make the restorations with very good results. Actually, sometimes you can even obtain a better result than with a rubber dam. But sometimes only the rubber dam can obtain the best results. Now, in scientific literature, we see that the isolation with the rubber dam is always proposed as a golden standard. The only negative effect is that there are traumas to the periodontal tissue, and these researchers are right. You see here one of the cases treated with success by Engin. Many times we support the isolation placing a Teflon. You can push these Teflon in the interdental triangles to ensure isolation before reconstruction of the neck. You need to avoid the whole coverage of the surfaces. If you use it in a correct way, you can avoid residues and the effects of those. This is a carious lesion of the neck of both teeth, canine and lateral. In this case, we see how we can apply an isolation with rubber dam. When you place the rubber dam, for example, personally, I do a retraction with the cord, but this doesn't have to be a rule. You can simply do the retraction with a clamp. But I think that it is safer to work with a cord. And I think that this is a way to protect the dam placed in cold water. So first of all, I do the isolation with the cord, and then I support it with a clamp, which is usually useful on the neck. Of course, you can decide based on the position of the lesion. As you can see here with the clamp, you can obtain a higher retraction. What is important is which clamp to use, because unilateral
yıkama
clamps can
süreçleri
compromise
kayabilir.
in a serious
Sırasında
way
problemler
stability,
yaşayabilirsiniz. Dolayısıyla
because
bunu
clamps can
iyice düzgün bir
go
şekilde
out,
yerleştirip stabil
they
hale
can
getirip
be
sonrasında
displaced, or the
restorasyona
cord
geçmek
can be
en
displaced.
doğrusu. Daha
So you can
ekstrem bir
have
vaka görüyoruz bu
problems
konuda
during
da.
reconstruction.
Bu vakada
For this
bazı
reason,
durumlarda flap
before
açarak hatta
starting the
işlem yapmamız
restoration,
gerekecek
we need
durumlarda
to
üst
place
düzey
the clamps
clampleriniz varsa
correctly
şansınızı
and
deneyebilirsiniz. Her
stabilize
zaman olacak
them.
diye bir durum
This
yok.
is an even more
Biraz da
extreme
dişlerinizi
case when you
elleme,
have to open a
yani o
flap.
diş etine
If you
zarar
have
verebilen
the
potansiyelini göz
clamps
önüne
that
alarak
are of higher
burada
level, you can
sıkı
use them,
sağlam
but this
clamplerle
is not
koruyabiliriz ve
necessarily
oraların üzerinden
successful because
penetrasyonlar
this can also
yapabilirsiniz.
damage even more the gums.
Tabii iyi bir
To
restorasyona
start
başlayabilmek
the
için
restoration,
üzerimizin bir kere
the surface, of
temiz
course,
olması
must be
lazım.
clean.
Bunu
And we
birçok
can do
şekilde
it in different
yapabiliriz.
ways. We can use the
Bu diş
paste,
temizliğinde
the ones we use
kullandığımız
for
pastalar
the
olabilir,
cleaning, or we can use
frez
the burrs.
olabilir. Ben burada bir
Today,
tane bile
I will
size
talk to you about a technique
partikül
with
püskürtmeden
particle jet.
bahsedeceğim. Bunlar
Now, these
genelde alüminyum
particles are
oksit olur.
usually
Diğer
alumina,
başka partiküller
but
de olur.
other
Havayla,
particles
suyla,
are okay.
gazet altında
And the cleaning is
temizlenebilir.
done
Bunu
with this
yaparken dikkat
jet of
edeceğimiz
water and air.
nokta diş etine
Well,
tabii zarar
of
vermeden
course, we
özellikle
don't
de
want to damage
kanamaya
the gums and we don't want
kanama
to
olmuyor
cause any
olabilir tabii
bleeding.
ki. Ama
Can a
onu da
bleeding
önleyebilmek
occur?
pahasına
Of
yapmak
course,
lazım.
but we
Videoya
must
bakacak
try
olursak
and prevent that.
diş etini
First, I
önce bir kontrol
inspect the
ediyorum
gums
nereye ne
to
yapacağımı.
see what I
Ortada hiçbir yeri
can do and where.
abrasyon,
Then I decide
bleeding
that there
varsa
is
onu
determined that there is an
temizlemek istiyorum.
abrasion
Oraya frezle
or anything
dokunmak
else,
istemiyorum
and I
ama
want
diş
to
etine de
clean.
zarar
I
vermek
don't want to
istemiyorum.
use
Böyle
the burr,
enteresan plastik
and I
kolye
don't want
uyguları
to
var.
create a damage in the
Buradaki
gingival
ara
area.
şeyi
Now, there are
püskürtmeyi
interesting
bu şekilde
protections
uygulayarak
for the
yapıyorum.
neck
Hemen
that are in
gayet güzel bir
plastic.
temizlik
I
oluyor.
apply the
Dikkat
jet,
ederseniz orada
protecting
küçük
the
bir
gums.
kanama
And as
oldu.
you can see,
Ama
it is easy to be
onda
cleaned.
bir kanama durdurucu
Oh,
hap
yes,
var
there
veya
is a small bleeding,
solüsyonlarla
but we can fix
güzel
it with a
temizlik.
patch or anti-bleeding solutions.
Preparasyondan biraz
Let's
bahsedelim değil
talk
mi? Bakıcı
about the
jet.
preparation. What do you
Evet, bu
think?
önemli bir
Yes,
konu.
it's a very important topic.
Şimdi burada
Here, of course, we need to
aslında
protect
gene
the
diş etini
gums.
koruma
There are small
prensibi var.
caries. We
Ufak
work
tefek
with a
çürükler var.
dental
Burada
burr
karbür
with
frezle
a slow motion,
ağır bir
using water,
sıvı
and without going
çalışmayla
too
dikkatli bir
deeply.
şekilde
We must also say that we
fazla
need
deri
to
girmemek
work
için
under magnification.
tabii muhakkak bunların
We
başında
always
söylemek lazım.
have to
Büyük
use the
bir alçı
magnification in
çalışmak
all
lazım.
restorations.
Bütün restoratif tedavilerde büyütmeyi
But
kullanmak
in the
lazım.
more
Ama
critical
böyle
points,
biraz
you see,
kritik yerlerde
if
bakın yani orada
if the burr moves more than necessary, or if there is an anomaly, or if there is too much bleeding, what can we do? Two things. Two options. Either you simply leave and you abandon the treatment, or you go directly to the rubber dam. Okay, let's go to the rubber dam. This is the restoration I did using a rubber dam. The animal can help us here. This is the best place to use. This is done with a burr using the shape points. Well, I call them like a rugby ball. We can use the ones with yellow or red rings, and I use a diamond burr because I want to ensure a smooth shift from the animal to the composite. Now, if I'm not mistaken, here you also have a case, you will show it later. This method can be applied also when we have animal tissue in the neck. It's a difficult point, but it's important because we need to proceed with adhesion. Okay, let's not take into consideration the dark colors on the tooth. We don't have to take out all the dark colors. Provided it's hard, the colors can remain. Actually, we do the last checks for this reason, because we don't want to forget anything. Okay, you can continue now. This case is very similar to the one we saw before. There is a lesion in the neck that is very deep. Here we have used beveling of the animal. And let's not forget that the limit and the angulation of the bevel is very important. What is even more important, as Engin already said, is to treat the area with acid so that it overcomes, it exceeds the limit of the bevel. We need to be cautious. Now, going back to what we said before, here you can see that if in the neck area there is animal tissue, doing the bevel can give us an advantage. Actually, in the restorations of the neck, we need to do the beveling of the animal tissue in any area we can. But this is not always easy on the cervical area. If you have a good retraction, you have achieved a good retraction, the result is good. Of course, if the position of the lesion allows me. Now, the adhesion is a very important because especially for non-carious lesions, we have serious problems with adhesions. Actually, according to scientific researchers, most of the materials are tested in this area on these lesions. This is the place where we have most of the problems with adhesions. And we need to be cautious on different things. Now, look at the researchers, and as you know, we have various methods like total etch, self etch, selective etch. I can say that you can use universal bonding. They are very convenient materials and they ensure clinical good results. And this is my personal opinion. And now Engin will tell us what his opinion is. In different methods, when they studied adhesion for wet and dry tooth with a self etch, there is not much difference between selective etch and total etch, but total etch prevails slightly. We don't suggest using only self etch. We have to apply the acid on the animal. This is a golden standard, golden rule. And now the floor to Engin. I'm going to show you this video, and the complete version of this video can be found in my YouTube channel. Usually, I use two different products on two different tissues. So, I use the dentin. On the dentin, I use a primer and the adhesive on the whole of the animal. Most of my treatments for restorations use universal bonding. Since this is a place that is a bit special from a medical point of view, I prefer to also apply dental cement. So I treat in a selective way the animal line where we did the bevel. Well, in general, I have been using the total etch technique recently, but since most of the dentin here is not covered, I did not touch it with the acid. But in minor restorations, you can use the total etch system. Of course, you need to be cautious with the time. For example, if on the animal the waiting time is 30 seconds, this time must not be exceeded by 15 seconds on the dentin. And after applying the acid, you cannot exceed 15 seconds because it's a risk otherwise. Here, the area is treated with microbrush after the application of the primer and adhesive. It is important to obtain a good polymerization. Here, what is important is the distance of the light tool. We must not keep it. We must not hold it far. It must be as close as possible because we think that the material is very thin, so it polymerizes quickly. And composites are polymerized in a quicker way compared to adhesive. Yes, this is a weakness in restorations. Yes. Well, it doesn't really matter what we place after that. Um, do you know? Okay, think about immediate dentin sealing. Yes, this is the fantastic example for immediate dentin sealing. Even if there is a problem with the composite we will apply later, the lower layer must be perfectly polymerized and adapted in its place. Now, the main element here, again, for resistance is the adhesive system. Now, restorations. Yes, this is very important.
Buraya kadar
In
geldiyse
my opinion, well,
bundan sonrası
everything ends here. I mean, because if we have come to this now without doing any damage, it means that we made it.
ama
In general,
şeffaf
I
ham
use a
yerleştirerek
retraction
hem
patch,
retraksiyon hem
but
izolasyon
with
yapmak
a
mümkün.
transparent patch like this,
iç
we can do the
beyazlatma
retraction and the isolation.
içinden çıkan
To
o
stabilize, I
bariyerler
use the
koyarak
barriers that are
onların
contained
ekolojisini
in
sağlamak.
the
Sonra
bleaching
içeri bir
kits. Then
enjeksiyon
I do the
yapıyorum. Bu
injection
akan
inside.
kompozitle yaptığım
This
bir
is a
restorasyon.
restoration I
Sıkı
did
uçlu bir
with a
alet, bu bir
flowable.
sond olabilir veya iğne uçlu bir spatula
Then,
olabilir.
with a sharp
Yavaş yavaş
tool, could be
şeffaf
a
taban olduğu
spatula
için
or a
daha
needle or
kolay
a
oluyor.
probe,
İşte
I
hava
check
buharı, buhar
for
yalıtımı
air
olduğunda
bubbles
birkaç tabakada da yapılıyor.
because
Restorasyonda
this is a
2-3
transparent
yeniler.
base. And
Birkaç
this can be
tabakada
done
olduğu
with a
tek
layer
tabakada da
or with different layers depending on the
Orada
size
ilk
of the
başta
restoration.
videoyla
Another
devam
video
edeyim.
here. This
Burada
is
da
a work
rubber
done with
izolasyonun
isolation
serbest bir
through the
çalışma.
rubber dam.
Her taraf
Here there are
kişisel
no
açık olduğu
limits,
için gayet
it's all
rahat serbest
open,
yapabilir
and
ama
this
tek
allows
tabakada yer
us to
alacak
work
bir
freely.
etrafında bir
But
kontrol olmadığı için
this
bir
cannot
bariyer
be
olmadığı
done with
için
only one layer
yani
because there are no barriers.
olsun hiçbir şey olmadığı için küçük
There
küçük
are no
parçalarla
transparent
çalışmak lazım. Biraz
patches,
sabır
there
işi.
is no Teflon,
Ama
there is nothing. So we need to work
dikkatli
one piece at a
çalışmayla
time,
varsın olsun
and we
işte
need to be patient.
10 dakika süreceğine 15 dakika sürsün eksikisi odur yani.
You need to do it
Yavaş
in an
yavaş
accurate way. If this
yine
usually lasts 10 minutes, this is going to last
sürmeyin.
15 minutes.
En ufak
Then
hava
we put the
en
layers,
ufak
and we
düzensizliği
need to
görüp ona
work
göre
with the magnification, and we
doğru
have
bir
to fix any irregularity
uyumlama,
or
yayma
air bubbles, and then we polymerize
tabakayı
each layer.
organize ediyoruz.
Siz genelde akışkan mı yapıyorsunuz?
Do you
Akan değil,
usually
akan
work
organize.
in
Yani
with fluid
dersek
of
içindeki dolguyu
flowable? No, let's call it
kullanmak
fluid
daha
because I'm
akışkan
trying to
olduğunu
emphasize its
çalışıyor.
ability for the filling.
Çok daha büyük
In the most
vakalarda
serious
alt
cases,
tabaka,
in
yani
the first
tam
layer,
üstüne
I apply
koymamak
the
olmazsa
fluid ones, and then in the
biraz artık
upper
doldurduğu
layers, the conventional ones. Now, since their filling capacity is really high, the job can also be concluded only using flowables. Now, it's very easy to work with these materials. You need to work on small pieces, and I am now used to using the brush. I usually use fluid composites, especially the ones with high filling capacity. But in the neck, I still use and I'm conventional composites after doing a correct isolation. Then I refinish using a brush. This is a similar case. We need to treat the area with acid, and the treatment air must exceed the beveling line because we don't know where the composite line ends. After applying the adhesive, we can place a transparent patch to protect the adjacent teeth. Using two different body colors, I completed the restoration. I did the lower layer with the incremental method using A to B. To avoid the shrinkage of polymerization, I did not create thick layers, and I completed the upper layer with A1B. We could have placed a composite on the surface, but it depends. It is not necessarily, and then finishing and polishing. That's great. It's really a case treated in a different way. Now, if we evaluate it only from the point of view of restoration, it is really great. But we will talk about the gums later. Of course, if it is such a big surface, the brush is very good. In general, I don't feel the need to use the brush in the restorations of the necks, but this is a special case which also includes the neck area. So my congratulations for how this has been done. Finishing and polishing. This is the most important part for a long, durable restoration. So you can do a restoration, but then what happens after 3 years? After 25 years? Well, I don't know. Well, we have to wait a long time to see the results. I think this is the key to success. And I would like to say that many times this phase is neglected. It is not considered important. Okay, so you finish the restoration, the patient leaves, and everything is over. But this phase does have a significant impact on the duration of the work. I must confess that while I was preparing this presentation, when I saw the videos about the work by Mr. Engen, I have seen the time he dedicates to this phase of the work to reach perfection, and so I realize that I still have a long way to go. And now the floor to you. Let's see these videos. Let's see what we see. This is the case we saw before. In healthy gums, when we do restorations, in spite of the barriers and then shrinkages and other things, that white part on the gums is caused by acidity. But if you see that there is no bleeding. The part where we took out, where we removed, well, there the oxygenated layer is thin due to the bleaching. The internal part under the gums is the clean part. Of course, you might need to do some more fixing. So we can say that this is good. There will be no leaks, I'd say. Yes, that's right. Next one. This is a very interesting case. Yes, that's true. Here, you need to be cautious. If you try and remove the cord before fixing the irregularities, a big problem can take place. As you see, everything else comes out together with the cord. And I'm sure that this has happened to everyone at least once. Yes, it did, but when it did happen to me, I wanted to share this experience with the others because things don't always go well. Sometimes there are surprises. Well, anyways, this is good. It's better if it happens now than later. Yes, you're right. You need to fix everything, and we can use the carbide burrs with the blade so we avoid damaging the gums. But we need to be cautious because the burr in some areas touches the composite and inevitably the tooth. Of course, we don't want to damage the tooth, so you must not use a uh, coarse grains, so not the ones with the brown or green or black or even red rings. I usually use Arkansas, but you need a burr that is appropriate to remove the big irregularities. So, of course, this was a magnification. Of course. Here, with this magnification, you even see the crystallines of the animal. This is a 4-time picture, so it's pretty big. Of course, you cannot see this with a naked eye, but our suggestion is always working with magnification. But of course, we don't want to damage the animal and the gums. Now, we remove the cord and we see what has been left because we might be left with pieces of gums. You see that now it goes back to its normal position. Well, I also helped it with the tip of the probe. You see, I clean the pieces of gums. Well, this is important. We need to work seeing but also feeling. Of course, there will be some bleeding, and so it will be difficult to see everything clearly, but using right tools, like for example a knife number 12, we need to do the checks and make sure that just check for roughness and remove any roughness. Well, for the success of restorations, well, then we might have to re-intervene again with a burr. Well, sometimes when I do it, not always, well, sometimes I close my eyes because I try and understand. I want to feel it instead of seeing that. But of course, you don't have to do that. Actually,
O
it's better if you
açıklayıcı
don't try.
çok kıymetli.
But, anyways, everyone has their own techniques. Now, to
Ayrı
conclude,
uçlu diyebileceğimiz
we use again plastic burr and we do the polishing. So we have a long term restoration.
Oraları bir de üzerinden
And then,
parlatırsak
well, these
esas
are the
uzun
follow up
vadede
videos.
başarı ancak bu şekilde gelebilecek. Daha sonra takiplerde de gösterirsek başarılısı da var, başarısız
And
da var. Hastanın
of
yoğunluğuna
course,
da
some
bağlı.
cases are successful,
İşte
others are not successful. It depends on the condition of the patient.
üzerinde her
It
şey
depends on
bağlı.
what the patient eats,
Ama
drinks, the
ortalama
way
biz
they brush their
verirken
teeth,
elimiz
and they clean their
yapmalıyız.
teeth. It
Ondan
depends on
sonra
many
ki
factors, of course.
duruma çok
We
fazla
have to do our
karışmıyor
best.
yapabileceğimiz
Unfortunately, we don't
takipler
have
var.
any
Hastanın
control on the
yoğunluğunda
following
bahsederiz
phases. The
konuşmamızda.
only thing we can do
Bunun
is having
ben bunu kendi
follow ups, and
problemlere
we are going
yapıyorum.
to
Biraz
talk
ondan
about
bahsedeyim.
follow ups at the end of
Genelde
the
rapordan ne
presentation. Now, the
yaptığımızı
floor
aslında
to you.
Kore
I
bölgesinde
wanted to tell you about
olabildiğince
my
yakın
protocol.
zaten nasıl yaptığımızdan
As I said
bahsetmiştim.
before, I used a rubber
Genelde benim
dam,
uyguladığım
retracting the neck as much
olabilecek
as possible.
hastalıklarda
Yes,
engellemede bahsettiğim
also,
karbür frezleri
as
görmüş. Bir
Mr.
şey daha
Engin, I use
dost
carbide
bir şekilde
burrs because they are more friendly
daha
to the
size
tooth
görünmeye
and there is more
çalışıyorlar.
control on
Makbul
the
oluyor.
gums.
Fakat
But
ben
I'm able to
küçük
fix
çaplı olan
irregularities with
disklerle yapıyorum.
small
Disklerle
size
de
discs like the
o
ones you see
bölgelerde
here.
daha kontrollü
They must
düzeltmeler
not
yapabiliyorum. Çok
have
kalın grenler
coarse
olmalı. Yani
grains.
orta gren ya da
You
daha
have
ince
to
grenlerle
choose the
yapmak
ones with
lazım.
medium or
Çok fazla
thin
yoğun
grains.
komşunuz varsa tabii
If there
önce
is a
karbür
big
frezini düzeltip
irregularity, of
sonrasında
course,
kısma geçmek
you need to
gerekli.
treat the area first
Ve
with the
şiddetle
carbide
tavsiye edebileceğim kendi
burr
kullanım açısından hem
and then
yüzey
go to the
fırçalaması.
ones
Yani
with
sarılıklar böyle
thinner
biraz daha
granules.
küçük çaplı olanları
My
kullanmak daha
suggestion
avantajlı.
is
Diğer
also
türlü
using
fırçalarda
plastic
en derin bir şekilde
spirals with
yapabiliriz,
diamond
yapabilirsiniz. Burada diş
grains.
spiral
They're
temas
very
farkı yapıyor.
good
Diş spiral
for
lastikler
the polishing of the
bence çok
surface.
efektif.
In the
Gerçekten
cervical
her
area, this is
markete
less
bakılınca aslında
effective.
çok
You need
efektifler
to
değil
use
mi?
the ones with
Onları gerçekten
lower radius.
doğru evet.
And these are very
Gerçekten işi
successful, of
kolaylaştırır.
course.
Bir şeyler
Yes,
yapıp
of
cilalayı
course,
yüzeyi
after the
şikayet
introduction
sağlayan
of these
şartlarda
tools,
sürgünle boyayıp
it is no
kontrol edip
longer
tekrar
so important
salonda
to use
sizlerleyip
one's hands.
hızlıca bir daha cilalayabiliyorsunuz.
And
Artık
this
o
has
işten
made
güzel bir
everything much
tanesi.
easier.
Önce
We
kalın
can
grenleri
conclude the
eğitip sonrasında
work
burada
in a very
gördüğünüz gibi
short time,
ince
starting
grenli
first with the
olanlarıyla hem
coarse
Kore
grains
bölgesinin
and then
yüzeyi
thinner ones and
cilalayabiliyoruz. Hem
polish
kısa sürede
the neck and
bitirebiliyoruz.
also the
Ben
surface.
susuz çalışıyorum.
I
Soğuk
don't use
olmadan.
the
Susuzun nasıl yapıldığını
refrigeration of the
şaşırabilirim ama ne
water.
yaptığımı göreyim istiyorum
Of
biraz.
course, you can work with
Birazcık da
the
diş fırçasından
refrigeration, but I want to
hassasiyet
see
hastası
what I'm
olabilirsiniz
doing.
anlatıyor.
Of
Fakat
course,
post operatif
this can
hassasiyet çok
create
uzun
some
süreli temas ettiğimiz şeylerin olmayacak
sensitivity for the
olduğunu
patient
düşünüyorum.
during the work, but
Genelde
not
uyguladığım
after the
yöntem bu.
procedure.
Ayna
This
gibi
is the
oluşlardan
method I
yoksa
usually
genelde
use.
yüzey. Kore
Well, it
bölgesi
has
siyah
become as
dişler
a
daha
mirror.
renkli.
Yes, it's
Isınan
true.
bölgelere dikkat edin.
But this is only
Sonrasında
the
üç boyutlu
surface. In the neck
model
area,
olarak düşünmek
the work
lazım.
I
Sadece
do,
görünen hastayı memnun
the
ettiği
work you
kısmı değil
do are
aslında
very
esas başarımız
important.
bu
So you need to
noktalarda
be
görürken
very
diş
cautious
etiyle birleşim
with the
alanları,
neck
macera
area
alanları
and with the
gerçekten.
gingival margin.
Burada da gördüğünüz
In
bu
this
vakanın aslında
image,
son
we have the
hali.
final
Uzun
image, the
ömrü
final
maalesef
part of the
ama
case we
öyle
saw.
bir
I don't have
mesela
the
2
long-term
haftalık
follow-up
aslında
images,
kontrol
unfortunately.
diyebilirim. Bu
So
vaka
this is after
sonrasında çok
15
ciddi bir
days. And in this
retraksiyon
case,
yapmıştı.
if you
Bu
remember,
aslında bir hafta
we did a
sonrasında
very
dişlerin
deep
tam yerine
retraction.
oturması ve tamamen
Usually,
soluk
I
halde
expect that after
tamarsız
1
spiral
week,
yapması
the
beklerim ben ama
gums
bu
go
vakada
back to
o çok
normality,
kolay olmadı
taking back
henüz.
their natural color.
Burada da
Unfortunately, in
gördüğünüz
this
gibi
case, this was
diğer
not the
şekilde
case.
gösterdiğim
It was more
küçük
difficult. This is
sebep
the
oluşan
final
servikal
state
mezotelium.
of the case we saw
Hemen bir
before
mavi,
with
tek bir
carious
renkte
cervical lesions.
kanama
We used
efekti
only
ve
one
kaliteli
color with a
çizgilerle
material
çok yüksek
which
olan
has a blending effect and like a chameleon effect. Well, these are very good products. In some cases, one color is sufficient. Engin says that in these cases it's better to use blocker, and he's right because to cover the underlying color, you need to first apply a small amount of blocker and then start with the colors to have a better result. And I think that you also did cases like this in the neck area. Well, the color we couldn't call, well, I'm sorry, clean. In this case, you can have the light reflection to give a natural aspect. And now, the long-term follow-ups you see here. Well, you talked about blocker. Well, to tell the truth, you need to use it with caution. We cannot cover every time we see a discoloration. Before starting the restoration, you need to measure the level of color and space. In a very deep restoration, there is enough space, but if it is a more superficial restoration, using both the blocker and the material can swell the area. So you need to apply a very thin layer. As you can see here, there is a bit of a difference in opacity. Well, I guess here I exaggerated a bit. Patients don't see this. Actually, they say that it is brighter. But I would apply the blocker in an even thinner layer, or as you said, I wouldn't use it. I wouldn't use blocker so that the light can be reflected and the look would be more natural. This is a case treated with blocker, and this was treated directly with omnichroma. The restoration is on 3 teeth. The canine and the molars were done with omnichroma. Well, great work. Yes, patients don't notice this. In general, patients are satisfied because there is a comparison between before and after. Of course, they're only interested in the final result, in the final look, but I'm interested also in the contour, in the adaptability. Of course, these are things that are much more important. Well, maybe the color won't be perfect, but the condition of the neck and the tightness, they must be perfect, and the sealing must be perfect. This is another case to be treated with omnichroma. You see here there is no need to use blocker. Well, for me it is more difficult with the lower arch. Yes, there is not too much space, they're very small, you really need to work with caution. And even though they are 4 together, I work on them one by one. I treat all of them with the acid and then I fix them. Okay, this can be done in only one appointment, of course, but it's best to do it one by one. Yes, you can do it one by one. I'm going to show you an even more difficult case. When the necks are like this, the work is even more difficult. It's even difficult to place a dental floss. And also the polishing is a problem. You need to use plastic, you need to use even smaller plastic burrs. This has been done with omnichroma. Now, follow up. Follow up is very important, especially the long term one. Also, short term ones. We did a job and we're curious to know how it went. So, what happens after the polishing? Okay, and there also the gingival bleeding, but then we send the patient home and we tell the patient that this is normal, but and this is going to be solved in some days, and the patient says okay and they leave, but I also would like to see what has happened. So in the next week, after all the restorations, we want to see the patient. I also would like to say that according to scientific studies, the follow-ups, I published a new article about follow-ups. 4 years. 4 years are considered short term. 7, 8 years are considered medium term. And now we are going to see the follow-ups that are much longer. They're very difficult jobs. I mean, following the jobs that you did many years before, using the materials that were available at that time. Well, this is really impressive. Now the floor to you. Well, one day, this patient came to my practice. I do routine visits and I call my patients every 6 months. The patient comes, but maybe he or she doesn't come because I don't really want to insist too much. But we would like patients to come, and I saw this problem during a follow-up, and the patient didn't know about this situation. I had done the restoration of the neck to this patient, and then I saw this dark color due to the blood or inside the tooth. But of course, dark colors are due to many factors. Well, if we want to call this defect, well, we would not be fixed superficially, but we could
Diyelim
do
içinde
a
bir
reparation of the restoration.
restorasyon tamiri
We can consider this a
düşünebiliriz.
reparation.
Yani
It
kompozitin
was
o
enough to
bölümünü
remove the
tamamen
involved
kaldırmaya gerek
area
yok.
of the
O bölümünü
composite, but not
kaldırırız.
all of
Tabii
it.
orada özel
We
bir
can
restorasyon
make a
yapılmış
new
şeklinde
restoration of
düşünebiliriz
that part
ama
only. Of
burada
course,
da
we need
ekler
to
gibi
be
gene de
on
mineden bir
the
destek
animal.
almak lazım.
And
Dolayısıyla
of course, we need
açtığımız yeri
to
ona göre
fix the part
düzenlemek
we
lazım. Yani
open, 50-50.
50-50 derler ya, yani
You need
o
to
açık
take a
kısım
piece of the
tamir edilecek
animal
kısım kadar
the
da
same
bilinen
size
gibi
of the open part. Yes, that's
olmasına
true.
göre de freze olabilir. İşte
We can use the burr or the
başka
particle
bir
jet,
sürmeyle de olabilir. Her türlü olabilir. Gene bir
taking into
şekilde
consideration the
tamam
protection of the gums and avoiding the bleeding, and
restorasyon
then we can continue the
aynen dediğim
restorations
gibi
with the usual
yöntemlerle
methods we
devam
know.
edelim. Tabii burada total
In this
açıklamalar
case,
olur.
using
Eski
your
restorasyon
method is
kompoziti
more appropriate after isolating and after cutting the old composite. You need to fix and clean the
eski
surface.
kompozitte pek bir şey yapmayacak
The
ama
application of
en
the
azından
acid,
yüzünü
apart from
temizleyecek.
cleaning the surface,
Benzinleriyle
will also increase its
közlendirecek. Gene
roughness.
günde 30
We
saniye
always
belki 15 saniye
comply
kullanmak
with the
gerekiyor.
rule of the
Belki
time, 30 seconds on the animal
izolasyonu
and
ve
15 on
retraksiyonu
the
sağlamak
dentin.
için artık ip
And to
veya
ensure the isolation
bant
and
veya
retraction, we can use the
kanvatlardan
cord
birini
or
veya
the
ikisini bir
strip
arada
or both.
kullanarak
And then we complete the
restorasyonu
restoration
tamamlayıp
and we
bitirme
start
tekrar
with the
devam etmek
polishing.
ilgili bir durum.
So, how can we define
Uzun dönem
the long term?
tabii yani 10
Of
seneden
course,
sonrası
after 10
uzun
years,
dönem.
we could consider this a
Burada
long term.
23 yıl ama
Here,
biliyorum
we see
hastayı
a
da tanıyorum.
case
En eski
which is
hastalarımdan
23 years old. I know
hala
this
ağzında
patient.
bu
He's
restorasyonlar
one of my first
25
patients
olmuş.
that I
Bir daha
regularly follow.
gelebilirse
He
eğer
still has these
tekrar
restorations, but actually
şey
now
yapıyorum.
we're talking about
Yaptırmaya
25
çalışıyorum.
years in total.
Burada
If he
bütün üst
comes
dişlerinde kore
again, I will take
restorasyonları
another
var.
picture for an
Dikkat ederseniz
updating.
geldiğinde kenarda renklenmeler,
He has
sızıntılar var.
this restoration
Bazen onları sadece
on the neck of
kaldırarak
all the upper arch.
temizlemek mümkün.
If you see that
Çok
there are
az
dark colors
vakada da ekleme
and
gerekiyor.
also
Burada
some
ekleme
leakage,
yok. Sadece işte
we can
üstüne Arkansas
clean
taşla
them by removing
kenarlara
them.
müdahale edip o
Maybe I can
renklenmiş
also make an
kısımları.
addition.
O dediğim gibi
But
10
here,
yıl olmuş
I
olabilir.
simply
Yani çiğ
intervened
10
with an
yıl
Arkansas
hikayeler
and I cleaned the
taşan
involved
kompozitler
areas.
özellikle 11 numaranın
Well,
arasını
what happened here is, as you said, probably there was a leakage. You see, like for example on 11. But this can be simply solved with a burr, with a plastic tip, or with Arkansas, or with a normal burr, or with the discs, or using both of them. Well, we can say that this is an updating and can be done in 3 to 5 minutes, depending on the number of teeth to be treated. Of course, 23 years, this is a really long time. The interdental coloration areas can trick us as if there were a lack of color matching. Yes, because after you polished, we saw that there was no lack of color matching. Well, this customer smokes, so you have nicotine on the surface, and then this patient drinks. So, okay, this is a problem for the heart, but anyways, this is a good quality composite. This restoration was done 16 years ago. It is a more complex work. This is 24 years old, but this lady had a very good oral hygiene. This is a patient who never skips the follow-ups. Actually, when we forget, she calls us, reminding us that she needs to have a follow-up. So don't be surprised. So if after 24 years a restoration can still be healthy in those circumstances. Maybe every time the patient came, I did some retouch here and there. And every time she comes, I propose to her, well, these are old. What about doing porcelain veneers? And she says no. And she says, no, I'm okay. This is really exceptional, considering all this time. And now I would like to add some data showing us scientific studies This is dealt by these studies. In the past, the restoration of composite was considered a failure according to FDA scores. The survival percentage of these changes was low. Well, it was not very low, but it was about 80, 85, 90%. But this success, well, does not correspond to the restorations of 20, 25 years. We are talking about an average of maximum 7, 8 years. There is not yet a study showing us the success of a reparation of the restoration of 20, 25 years. Well, maybe they will find one. Yes, you're right. That's why your work is very precious. Now, according to the studies, like this one and many others, show the advantage of repairing the composites. And what is this advantage? Well, in the follow ups, we can retouch and fix it with the polishing, the compromised parts, even though the patient doesn't even notice their existence or doesn't complain. And then the composite remain functioning in their mouth. And also, the researchers say that even the composites with low scores, considered a failure not only in the neck but also in the posterior part, are durable restorations. This means that there is no need to change them because they are considered a failure. Well, in one of our publications, we said this. If we consider the success, the time of the restoration being functional, the percentage with the follow ups in 7, 8 years reaches 100%. I think that you also made checks very frequent because this is really important. Yes, it really is. But we find out only if the patient comes back. We concluded the work, the patient leaves, and then what happens? But of course, there will be some failures. It is impossible to satisfy everyone. And then we are not robots. It is impossible to do everything perfect every day. But over 90%, we could consider this a success. Yes.
Dediğim gibi %90'lar ve üstü başarılı olarak kabul ediliyor. Hele böyle yıllarda gerçekten doğru.
Dear colleagues, this is the end of the presentation. Thank you, Bora. Thanks to you, it was my pleasure. You really worked very hard. Yeah, it was a pleasure. I tried to contribute too. And I hope that our presentation will help our young colleagues. So, goodbye from our beautiful Istanbul. So, see you next time. Greetings again.
Kole'deki biz o taziyeden sonra kes dediğimiz yerde kestik mi?
Kestik.
Tamam, görelim.
Araya geliyorum ben. Şurası şimdi.
Tamam.
Kesilecek.
Kole tarafında da bir mine dokunuz varsa o da bizim.
Stop, then I can cut here, so it's perfect. It has come out very well. Congratulations.